is to see that he settles, he earns money, he buys a car, he has a good house, he can have, after 10 years or 15 years of practice, one more house, little bit of property. 15 years of practice, the children become a little bit older, have time balance so that the education will be given. And then they starts making international trips. Most of us do that 9 out of 10. So if you look at, they all think of themselves and their family and their kids. And 40, 50, 60 years of active practice, if we really sit together and analyze what did you contribute to the society, you will realize that 90% contribution you have done to yourself and your family only. You have grown within your barriers. You have never grown outside the barriers. And this is the reality in 90% of undergraduates and postgraduates in allopathy. The same thing may be the Ayurveda, dental, homeopathy. The dental scenario is so poor now that 80% of the admissions in dental college are taken by girls, and 80% of them don't practice. They just take the degree. And I asked most of their parents, first thing, this admission season, a lot of them come to me for advice. What is your ladka acha milega usko? The degree is for matrimonial blessing. And this is the reality. What I am telling is the truth. I'm sure, how many of your kids are doctors? So say around 15% of them are the kids who are pursuing medical. I have a different thought process altogether. When I started my practice of pediatrics in Pune, we were 155 or 160 pediatricians. I started somewhere in 1992, 93. I joined Bharati as a junior lecturer, and no direction of working, no advice, all permutation combination. Joined this medical school at 4,999 salary, with no OPD, one room, no direction, boss on papers, not coming physically, and running a medical college. Today, there are 1,250 pediatricians in Pune. And Pune suburb and Pune district together have 1,700 pediatricians. As the patients increase, in fact, the disease has decreased tremendously. It's all gone. Asthma is gone. Pneumonia is gone. Malnutrition is gone. Family sizes become small. 1 or 2. So it's a competition. Everybody wants to survive. I think the same thing is in general practice. You take Dhankaudi's pocket from this left heart, they will get at least 200 GPs of family physicians, and they are increasing day by day. So I personally think so that one of you may not be able to change it, but your kids should be given direction. Apply साचा बनना है, अपन खूप flexible होऊ शकतात. माझा हे लेक्चर मधून तुम्हाला काही फायदा झाला तर ते घ्या, नसेल तर डिलीट करा. I have no issues, absolutely. I look at my son and I look at my growth. I started my career in Bhakti, no direction. Boss, no direction. I, no direction. For topper in BJ, topper in MD pediatrics, no medical background at all. And started in Bhakti. OPD was 2 or 4. Used to pay, used to come on duty, used to run off. All typical वो character चाहिए वो सब रहने. And then I started working here, and then I realized that if you don't have direction today, you can't work. You need directions the day you start your project. Somebody will make you understand how you should go. So if you look at my curve of first 10 years and the curve which I give to a younger pediatrician today, there's a huge difference. There is no comparison at all. I analyze my data in monthly of my students working beyond barriers. We had 140 PG students who have passed academy in pediatrics, and we have 450 fellows for all pediatrics subspecialty passed academy, highest in the country today. Which the highest is neonatologist, maybe 160. Intensivist pediatric maybe 15, 20, neurologist 20, endocrinologist 15, ID infection disease pediatric 8 or 10, developmental pediatrics 50. And then I had the alumni meet around 6 months back to assess where they stand. 5 years, everybody settled. Enormous practice. Because they had direction. They never did routine pediatrics. They focused themselves. And I made them we have one session for exam going students which might address them. What is beyond pediatrics when you start practice? You must decide where you want to grow, what is your career. I'll give you an example. There was a girl called Dugat who came to me for MD pediatrics. He was from Jaisalmer. He didn't have a father. Mother had some property, she managed her fee. She gave it installed. She got to God, if I remember the name. Sir, वो pediatrics को करने का नहीं था. My mother, father put in pediatrics. So I want to resign. I want to commit suicide. 3 months she did not come. Then I called her. I told क्या बात है? तुम लोग को गायनेक करने का था. Pediatrics मेरे को लगा भी नहीं. बोला अभी pediatrics लिया है ना. Put your head into it. We will support you. And she started her career. JR, she was a little bit left right, and she became JR1, JR2, JR3. And she really did very well. She passed with flying colors. She came to me, the Marwadi लड़की में बैठे लोग लड़का देख रहे थे. माँ ने बोला कि आपके पहचान में कोई रहेगा तो मगर पीछे वो तो कैसे बनते. And that time we had Dr. Dhawan coming from Red Ormond Street to Bharati. The pediatric hepatophysiology surgeon, hepatophysiology physician in US, UK, GI is different than hepatophysiology. After the Dubai combined करता, Dubai वेगळे, उन्होंने मुझे खूप चांगली आहे. He went back, and he wrote a letter that I have one post empty somewhere. Can you look at her? So I called her. I told you a काम कर. You go to Ashish Pavekar in Pune. I will talk to Ashish, get sensitized, and then you decide whether you like hepatophysiology. Then I will ask doctor where you should. He went, she saw, told her, go and check. Look at her journey. Post MD at 5 years, she was grown beyond barriers. Now she's become a consultant. She's at Leeds, and she is now a liver transplant physician pediatric. And when I met her recently, when I was in Bristol, she flew down to Bristol. And Bristol, I remember those days, I have gone beyond barriers. We need to understand, we need to culture students for their growth. There are so many like these stories which are beyond limitations. Second, I personally think so. Most of us look at our own growth. All your youngsters should be taught to look for a group growth or a team growth. Why I tell you? When you grow yourself, you have a lot of limitations. I was talking to Praveen just now. Sir, it is not worth it. My son came to me, he passed pediatrics. He came to me and he told, "Bola, काय करायचं तुला?" तो म्हणला, "Not sure, Dad." बोला, "You must specialize in pediatric pulmonology." तो बोले, कुठेच pulmonologist नाही, काहीच करता येत नाही. Adult pulmonology खूप developed आहे. One branch which will develop in next 5 years, mark my words, is pulmonology. There are no takers of pulmonology 10 years back. Other only pulmonology. 2026, it's all on environment, climate change, and pulmonology. It's going to be a huge game changer. So I told my son, I told him to do pediatric pulmonology. So 4 years back, I thought, let's develop pulmonology. In India, Mala groups are there. I went down south, I went to PGH in Bihar. I went to Angel. Every month I move up reported out to see what's happening across the world. Luckily, we had one conference here of pediatric pulmonology at JSC Bangalore. I was the organizing secretary. I met Satish Rao. I produced it in my car. I want to take my meeting. He came together. He saw the pediatric setup and he told, "What you want?" I told him, "I want your support to develop pediatric subspecialties which are not developed in India." So we picked up 4 streams. We picked up pediatric pulmonology, pediatric GI, pediatric hemato-oncology, and rare diseases of child. These 4 things I picked up on. So we signed a contract that they will help us to develop these specialties. It was pre-COVID time that time. And we chose a dual fellowship candidate. Fellowship एक वर्ष माझ्या अंडर ट्रेन होते, एक वर्ष बर्मिंगहॅमला जातील, आणि मग end of 2 years they are free, but I can put my word that this boy should be sent back because he needs to develop my unit here. ही फेलोशिप चालू झाल्यावरती 4 वर्ष झाली, 4 मुलं पास झाली. Siddhant comes back, and then I asked him, "What you're going to do?" So, "Practice." No, practice everybody does. Do your work has any translation value to the society? Think on it. You come back, you should come to Bharat. Don't be in this now of 100 OPD and 150 OPD. Now slap and say, practice of equality. 4 लोकांना फोन पर दुसऱ्याचा 8 दिवस का करा, confusion question झाले. Beyond all this, you have to come out of this. And that's what I look at. मैं आजकल तक उनके लिए होते हैं कि कभी जाने का क्लास नहीं है, because वो वेदस मस्त के बड़ा चलता है. So I come back today. There is no pediatric pulmonologist certified in Maharashtra. Come back, do original research work, take out one good publication which has a high impact factor and a good translation value. Does your practice changes the trend? I know how many of you have heard Dr. Palm's story? Have you met anything? Yes. Beyond barriers, which are how his wife and he were working in Sadrapur area. They thought that under 5 mortality in those tribal areas is high. Can we intervene somewhere that we can decrease the mortality? So what they did, they trained the ASHA workers. That's what we are doing now. आजपासून आम्ही 3000 आशा वर्करला ट्रेन करणार आहे पुणे डिस्ट्रिक्ट मध्ये. काहीतरी माझ्या डोक्यात मोठा रिसर्च प्रोजेक्ट माझ्या डोक्यात खेळतोय. म्हणून this month is my ASHA worker month. Every day 100 ASHA workers are picked up and got to Bharat. There is one training. Every day they go to the training program. They taught ASHA worker to count the respiratory rate of child below 6 months, 6 to 2 years, and 2 to 5 years, and say that if respiratory rate is more than 60, more than 50, more than 40, give 1-2 doses of Ceftra, plain Ceftra. So then ASHA workers, they validate ASHA workers, they count करतात की निदान सगळं केलं आणि ASHA workers कडनं त्यांनी टॅप केलं. You know what was the study? 3 years after training, after giving set run, the under 5 mortality in those age group came by 30% down. The same thing was presented internationally. The same thing was adopted globally by WHO. That विचार thought beyond barriers. आपकी OPD, 50 OPD, 60 OPD, 40 OPD, सगळे काय सगळे करू शकत नाही. I fully agree. तर तुमच्या मुलामध्ये potential आहे. Let them go beyond barriers. Please look into it. Please look into it. There are so many things these youngsters keep on doing. It is out of the box. आमच्याकडचे इथले pediatricचे काही मुलं अतिशय उत्कृष्ट काम करतात. हे कुठली मुलं येतात. Few years back, when I started this child guidance clinic, I picked up one girl, Pravina Srivastav Pandit. She is practicing in Karvinagar region. Only practicing. त्या मुलीमध्ये एक चटक होती. I realized that she has a vision. आता वेळेला तू काय करतेस ते म्हणजे सर मी ओपडी महिन्याला 50 लोकांची पिडियाट्रिशियनची प्रॅक्टिस व्हॅक्सिनेशन वरती अवलंबून आहे. तुझं पोटेन्शियल आहे ना, why don't you start coming to भारतीय तारीख म्हणजे सर म्हणतो डेव्हलपमेंटल पिडियाट्रिक करायचं म्हणजे आम्हाला पिडियाट्रिक असताना डेव्हलपमेंटल पिडियाट्रिक करायचंच नाही. काय ऑटिस्टिक आहेत, काय डिस्लेक्सिक आहेत आणि काय डिफिकल्टीज आहेत माहितीच नव्हते. म्हणलं यू गो टू श्री there's a very good child guidance center. You spent 1 year there. I will support you. He went. And she came back. And you know, म्हणजे सर स्कूल प्लेसमेंट लागतो, लागतो, ऑक्युपेशनल थेरपिस्ट लागतो, चाइल्ड काउन्सिलर लागतो, म्हणजे सगळं घेऊन. Now, in the span of 7 years, 8 years now, we got a team of 20 people who runs the child guidance training. And what is the situation, you know? The pediatrician are having a tough time, but she has a waiting of 6 months. मी त्याला एक कंडिशन दिलं, हे सगळं तयार करेल, पण बाकी सोडायचं नाही. So the attrition rate in pediatrics is 0%, because they all have grown here. And तुम्ही 4 नंतर प्रॅक्टिस करा, पैसे कमवा, काही करा, पण 9 ते 4 मार्केट करा. You don't go anywhere. I deal with lot of super specialty hospital काढल्यामुळे खूप फॅकल्टीशी इंटरॅक्ट होते. Broad specialty, super specialty. The most difficult are super specialists. Broad specialists are easy to manage. Whether we like or dislike, there is a genetic preponderance of people. I see a lot of faculty who works beyond barriers, down south people. They work beyond barriers. Up north, they are super duper barriers, genetically predisposed. Very few exceptions. I made one, you might have heard one doctor, a famous rheumatologist from CMC, Dr. Danda, D-A-N-D-A. In Google search. I asked him, sir, I came to know that he is retiring in August 1st week. मी असं माहिती घेत असतो सगळीकडे कोण कुठं रिटायर होतो, कोण किती महत्वाचं आहे. माझं एक स्वप्न आहे 2027 ला मी 60 वर्ष कंप्लीट करणार. तिथपर्यंत this institute should be rated among the first 5 institutes in the country. And I personally think so. I don't work for myself anymore and beyond that. मी जातो दंडांचं सर्च केला, मला कळालं की ते सोडतात त्यांची बायको DM जेनेटिक्स आहे. 2027 ला रिटायर होणार, सर 2023 ला ठरवलं. त्यांना मला सर्टिफिकेट पाठवतो, तुम्ही या. ठीक आहे, ठेवलं. तर म्हणजे माझ्याकडे जॉर्डन सिस्टमचे 3,500. I have a systemic lupus 35,000 cohort. He is a father figure of aortoarthritis in the country today. Takayasu is the mentor. Sir, I work in CMC level. No, sir, when I saw his salary, you know how much you are getting paid as a full-time person? 3.1 lakhs per month. was the salary after 40 years of service. And then I look at contemporary of his who were into practice. They all worked in barriers, who worked beyond barriers. And today, look at his citation index. पुढच्या काळातली पोरं हे सगळे ह्याच्यावर प्ले चालणार आहे. केवढं तुमचं इम्प्रिंट करू शकतात. त्यांनी मला कंडिशन सांगितली. मी म्हणजे तुझ्याकडे मी सेटअप दाखवला त्यांना ते म्हणजे मी येईन पण माझ्या काही कंडिशन आहेत. मी 4 महिने करतो. मला बेसिक सायन्सची लॅब लागेल रिसर्च करायला. माझ्याकडे खूप ब्लड सॅम्पल्स पडले 15-20 हजार. I do basic sciences for research work. That is, you will be able to find. Once you are done, you have to come. And we have reached that 75% rate. I'll give you another example. This is what I have myself seen. Dr. K.V. Menon Antakar joined. I know Vinu from his MBBS place. I was tracking him from MBBS place. He did his MS orthopedics from Raman Hospital. Went for spine fellowship in Glasgow. Came back to America. Worked 10 years for Mark with commitment. Went to Collar Hospital in Muscat. 3 years. Again went to UK. Then his daughter was pregnant in Bangalore. Then I got a cruise shifting to Bangalore. I met him in Bangalore when I went to Ramaya. Some other visit. I told Venu, why don't you join me? He said, Father, your spine is being no time. But I will come. I am a co-researcher. So I told you come. I talked to Vishwajit Bampo. I said, sir, I am converting. I told him, whatever you want to write on a piece of paper. He wrote. In that writing, there was not a one word that my salary is so much. He only wrote, I want to set up, I want to research associate, I want to settle this spine, and these are my requirements for setting this spine. He came here. First, he was very disturbed, typical Bharati culture, we promote professional approach, medical record system, fellows. Now it's 3 years. He's a transformed man. We do 4 spines a day. His waiting is 3 months. Spine OPD is 70 per day. And he's a father of spine in the world today. Last week, he presented the best paper on spine at Prague with all his 10 fellows going with it. Because he worked beyond barriers. So all your children all the children want to make career. Don't look आपण एकदा पाठी तू ये मग आपण दुकान घेऊ आपण 15 फ्लॅट काढू आपण मग प्रॅक्टिस करू मी तुम्हाला विचार पुढचा काळ कसा नाही आहे. You have to work beyond what you want to do for the children. मी आता भारतीमध्ये प्रत्येक डिपार्टमेंट सेट करतो. I wanted to start DM rheumatology. There were only 14 seats in India. Management ला मला सॉल्व करायचं नियमात बदलत नाही पण त्याला 2-4 शॉर्टकट्स आहेत. आम्ही ऍप्लिकेशन केलं. आमच्याकडे कोणी पुण्यामध्ये तेव्हा 1-2च DM rheumatology होते आणि 16 सीट द्यायच्या. पण rheumatology इज द हायेस्ट टार्गेट आफ्टर सगळं हे डायनामिक प्रोसेस आहे. एज्युकेशन काळ डिमांड बेस चेंजेस करायला लागतात. तिथे जेव्हा rheumatology सीट आली ना 2 पोरं पहिली जॉईन. That girls are so talented. They are toppers of age and they have come to do rheumatology. Rheumatologists आहेच नाही कोणी. सगळे सेल्फ प्रोक्लेम rheumatologist आहेत. आणि बायोलॉजिकल मधनं rheumatology सगळंच बदललं. ट्रीटमेंट प्रोटोकॉल. Malignancy today, everything has changed. We really need to look beyond what we really have to do in the practices. 3-4 more things before मला हात वरती करा. So I can just wind up something like that. Beyond barriers, there are 3-4 things you must do. One is your field where you want to practice. Second, the way we are going to practice, it's all going to change in the next 10-15 years. All your kids will not have a solo practices. You look at the group practice which is going to be there. You must work as a team. None of the Indian doctors today go into research, taking up your own original article, looking up your own publications. I think our focus should be because त्यातून पैसे निघत नाही. पण खूप चांगल्या लोकांना खूप चांगल्या ग्रांट मिळतात. काही अवघड नाही. आम्ही तर सगळं शून्यातून तयार केलं. हे भारतामध्ये क्लिनिकल ट्रायल डिपार्टमेंट काढलं वॅक्सिन्स 2002 साली. आपल्या लक्षात आलं वॅक्सिन्सचं काहीतरी केलं पाहिजे. आणि 10 वर्षात नाव या बिकम द लार्जेस्ट हब ऑफ वॅक्सिन. Then I realized की या क्लिनिकल ट्रायलचे फक्त पैसे मिळतात. ना काहीच मिळत नाही. सर्वेलन्स सिस्टीम पाहिजे. तर आम्ही मोठी सर्वेलन्स सिस्टीम इस्टॅब्लिश केली लवळ्यामध्ये. आम्ही 1.5 लाख पॉप्युलेशनला 2 आशा वर्कर्स 2 iPad सगळे इव्हेंट स्टार्ट केले मागच्या 3 वर्षात. So all my interventions in community will be by that research activity. And that's what we are looking at very mindfully. Then we विचार केले report येतात. Why can't we apply for Center for Immunity? We wrote to ICMR. Dr. AC Mishra was the NIV director. I picked him up. I told him to join our team. We will support you. And it's so fantastic होतं. कोविड आला माझा प्रोजेक्ट केला. पटकन एका दिवसात पैसे सँक्शन झाले 50 कोटी रुपये. पुढच्या महिन्यात ट्रान्सफर पण झाले. And first Center of Study of Immunity and Vaccine was established in Bangladesh. So all samples of all vaccine trials in India come to us. So this is all beyond. मला हे शक्य झालं ना तर मी इथे काम करतो. आणि मला ना हे मीटिंग प्रॅक्टिस आणि संध्याकाळचे सकाळचे वाकडे तर मला खूप मोह नाही. पैसे पाहिजे, प्रॅक्टिसही पाहिजे, पण आउट ऑफ द बॉक्स थिंकिंग पाहिजे. So I personally think so all your kids who know how to grow, you must give them a direction to go beyond. 2 more things because of academics. Second, carve time for your friends. To us every day in the morning. कितीही बिझी असला सकाळी 2 तास स्वतःसाठी द्या. तिसरं, हेल्थ इकॉनॉमिक्स खूप चांगल्या रीतीने आलं पाहिजे. खूप चांगल्या रीतीने हेल्थ इकॉनॉमिक्स आलं पाहिजे. ज्याला हेल्थ इकॉनॉमिक्स येत नाही प्रॅक्टिस नाही करू शकत, ग्रो नाही करू शकत. एव्हरी इंटरव्हेन्शन यू नीड टू हॅव फायनान्शियल कॅल्क्युलेशन. So plan your finances very well. You must be a jack of all trade, an expertise of one trade, but you must know average everything of the trade which is there to be happened. So my thing to all, I'm just from extempore to talk to you. This madam had told me you have to talk something which is your experiences, and you must look at beyond barrier. So may I tell you, all of you, please look for your children to work beyond barriers. Look to grow as a group. Look to sensitize masses at large. You and me need to give to society something in return. So please give it. You must grow. You must have vehicle. You must go with your wife, young age, Switzerland. There's nothing wrong in it. You must. But think beyond normal pattern of things. Last thing before I close. We have from this year, I have taken an initiative to organize a CME called Medicon. It will be unique CME for the family physicians. There's going to be fantastic value of translation. So what we each year, we are not going to talk you anything which you don't have. But I personally believe तुमच्या practice मध्ये आमच्या CME 5% फरक पडला तर ही CME कामाची. What we have आपण हिस्ट्री बघतो खूप तास पण बघितलं तर कळत नाही. You must learn what you are going to practice, which we have planned. We have Dr. Venugopal is going to speak. He is a dynamic speaker. You should not miss to hear it. See the way he carries it. Look at his fitness. Look at his personality. Look at his command. Citation factor. Look, Venugopal's half of the spinal surgeries in the globe are by his name. It's all innovation. He does a lot of PhDs, a lot of programs. He's going to speak. Kavita Krishna, I think one of our rheumatologists, he is now shifting a base. He shifted from here to Nobel. To Sayadri Adam, sir. The mandate I got him now. I told him, say, he will give you money, but nobody knows, sir. She came to me like this one. मेरे बच्चा 10वीं में चले गया, दोनों बच्चे यूएस को चले गए, कभी कृष्णा हालत के छोटे से पॉकेट में ह्यूमेटोलॉजिस्ट की हेल्प बनेगी तो ऑल ओवर इंडिया जाएगी थेरेपी इंटरेस्ट one patient came once, she converted twice, convert in next 3 months full time. I'm very clear. These are dynamic speaker. He knows the subject in and out. He is going to speak. Dr. Mankar, I think, is a voracious pediatrician of city of Pune, a fantastic human being, a fantastic knowledgeable person. He is going to speak. So we have picked up people who will make you sit on your chair. It's going to be, we are just charging 500 rupees only because if you don't charge, people don't value you. Nothing should come free. Is I firmly believe. Everything has to be charged. So it's going to be charged 500 rupees. There's a person who is sitting outside. Mukta has done a good job. I am building on her base. ये मुझे registration होते हैं, मुझे मुक्ता जी क्यों आ रहे हैं? तो मैंने 200 तो काफी 200 तो 4,000 कम करेंगे. So I'm sure, of course, she, I like, I admire. She's another lady working beyond barriers. She's the role model. Why I forgot to quote her. She's beyond barriers. She's an ideal role model. Utsahi, eagerness, pride, commendable. There is no. She has worked. Purpose. काहीतरी आग्रह वेगळं आणि admirable. आणि मारवाडी बाई आहे घरात संस्कृतीचा प्रॉब्लेम खूप आहे. पण दुसरे टाकून कस्टमर खूप आनंद. I'm not here to criticize any caste or I'm also Marwadi, but I am because I have all national integration in my family. So I don't look at who is what. So I personally think the classical example beyond barriers. So each one of you contribute to be beyond barrier in whatever capacity you can do. So please register for the thing. And last thing, how many of you have visited Bharati hospital? So when you come to Bharati Corp, you will have a unique experience of that. That's not the hospital anyone has in Pune. I can assure you, I'm not here to blast you or impress you, but no hospital has the infrastructure what we have today. No hospital has the. I am very. मला कर्मांची माझं पटलं. तसे त्यांचे लोक माझं रात्री झोप 2 मिनिटात पैसे माझे नसतात. That is beyond barrier. Thank you. Brain is mind. You can't believe last week I had all directors of AIDS here, all 21 directors of AIDS here. I had 2 days research beyond thinking was my team. So 50 pediatricians were housed here in the whole campus. So I had taken to Serum, other Punawala meeting global vaccination drive, and they were straight. So few of them wrote, and I told to Vishwajit that if I am reborn again, I would like to become a professor of pediatrics in that. So I visit the next time if you do come, I hope you register. We cannot force you. We can request you. We will have a trip from here in a gold card. I've got gold card. Beyond by I could pour that now. Me management to charge gold. तो गाडी वरती पार्क करतात चालत चालत म्हातारे येतात. मी गोल्ड कार्ड घ्या, वेगळा एक्सपिरियन्स असेल. गोल्ड कार्ड. All the patients now are parking up to the category. So we have grown 100% in the last 6 months. We plan to grow 100% in the next 6 months. And we are very committed to patient care. Service सामान्य माणसाला परवडणारं चांगलं हॉस्पिटल. अतिशय फोकस काही डिपार्टमेंट प्रोग्रेस खूप झाले. काही डिपार्टमेंट त्याच्या मागे आणि सगळं माणसांवरती अवलंबून असतं. चांगला माणूस आपण करा इट्स ऑल चेंज. थँक्यू.
Thank you everyone for your inspiring words. Now I would like to call Dr. Prakash Mahajan, President, Mukta Charitable Foundation, to felicitate Dr. Dalwan. Now we will start with our inauguration ceremony. I request Dr. Prakash of Mukta Charitable Foundation to escort Dr. Sanjay Dalwani to the dais. I request Dr. Praveen Darak, Mukta Medicon Organizing Chairman, to escort Dr. Ramesh Bhange to the dais. I also request Dr. Rupa Agarwal, Secretary of Mukta Charitable Foundation, to escort Dr. Amit Dravid on the dais. I would like to extend a warm welcome to the guests on behalf of Mukta Charitable Foundation. I request all the dignitaries on the stage to come forward for the auspicious flag lighting ceremony. I request Dr. Padma Madam to come on stage. I request Dr. Hasmukh Guzar to come on the dais. Let us all pray to Mother Saraswati, the goddess of knowledge, to give us wisdom to make this world a better place. Tamasoma Jyotirgamaya, Mrityorma Amrutam Gamaya. May the darkness of ignorance swept away by the light of knowledge. Now I request our guests, Dr. Sanjay Dalwani and Dr. Ramesh Bhange, to release the souvenir of Mukta Medicon. I request our guests, Dr. Sanjay Dalwani and Dr. Ramesh Bhange, to release the souvenir of Mukta Medicon. Thank you so much, everyone. I now request all the dignitaries to take their seats in the auditorium. And I invite Mukta Medicon Organizing Chairman, Dr. Praveen Darak, to give his welcome speech. Dr. Praveen Darak.
नमस्कार. मुक्तकॉन ही पहिलीच कॉन्फरन्स होत आहे. खरं यावर्षी आपण सुरुवात केली, पुढे आपण बघूया काय कसं होईल ते. पण हे पहिले वर्ष आम्हाला असं वाटलं की 150 वगैरे होईल रजिस्ट्रेशन, पण खरंच सांगायला आनंद होतो की आपण 300ला पार केलेलं आहे. 300 रजिस्ट्रेशन केलेलं आहे. मुख्य म्हणजे लेक्चर कसे ठेवायचे याच्याविषयी काही चर्चा चालू होती की कसे लेक्चर असायला पाहिजे. तर आपले जो क्लास असणार आहे, आपल्याला जी डेलिगेट असणार आहे, जसे की जनरल प्रॅक्टिशनर मॅक्सिमम असणार आहे, हे तर माहिती होतं आधीच. मग त्या अनुषंगाने लेक्चर ठरवले गेले. मग त्यातले कोण टॉपचे तरी आहेत त्यांना आधी मी भेटलो आणि खरं सांगणारा विशेष आनंद वाटतो की 10 लोकांना भेटलो आणि 9 लोकांनी हो सांगितलं आणि 9 लोकांनी म्हणजे मी डोनेशन लगेच मान्य केलं. व्हेरी गुड थिंग. आणि आता मी तसं पाहता सगळ्यापासून की ते 2 लेक्चर झाले. डॉक्टर सोनार सर, डॉक्टर कपिल दिलपे, ललवाणी सरांचं काय एक्सपोनर टीचर्स काय, गुजर सरांचं झालं लेक्चर, बर्वे सरांचं लेक्चर झालं. असे सगळे लेक्चर जे आहे ते आपल्या सगळ्यांना उपयोगी पडणारे लेक्चर आहेत. विशेषतः मला गुजर सरांचं मगाशी जे लेक्चर ऐकलं मी, ते मी इतके वेळा ऐकलं, हे लेक्चर ऐकलं 3 वेळा, पण परत ते ऐकवंसं वाटलं. आणि खरंच चेस्ट जे आहे, म्हणजे कालची घटना अशी आहे की पेशंट हॉस्पिटल आला, डॉक्टरने उपवास केला, मला ऍडमिट केलं. आपण त्याला इग्नोर करतो. फक्त बीपी 150 100 होतं, पेशंट म्हणून डायबिटीज गेलं, मी त्याला ईसीजी काढला सांगायलाच पाहिजे. आणि तो ईसीजी काढला आणि मला पेशंट इन्फॅक्ट सापडला. पुढे भविष्यात ते पैसे मिळाले, पुढे तर गोष्ट वेगळं आहे. परंतु आपल्याला ईसीजी काढणं महत्वाचं आहे. जरी ईसीजी नाही काढला तर आता इतकी लोक चांगली आपल्या आजूबाजूला आहेत, सर आहेत, ती लोक आपल्याला लगेच ईसीजी पाठवतात, त्यावर सांगतात की हा प्रॉब्लेम आहे. जरी ईसीजी नाही काढला तर ईसीजी मशीन तरी घ्यायला पाहिजे, हे फार इम्पॉर्टंट वाटतं मला. मुक्त विषय म्हणजे खरंच या वर्षी फार कमी आहे. मी माझ्या काही इतर कामामध्ये अडचण होतो. हे मॅक्सिमम एफर्ट घेतले ते सगळ्या टीमने घेतले. यामध्ये निश्चितपणे रूपांतर यांचं खरं जास्त योगदान आहे. मी आहे, महाजन सर आहे, पण काही नावं मुद्दाम सांगायला पाहिजे की ज्यांनी याला खूप जास्त एफर्ट घेतले. यामध्ये जयश्री ज्योती शिंदे मॅडम आहेत, डॉक्टर शर्मिला शिंदे आहेत, डॉक्टर जयश्री सोनीस आहेत, डॉक्टर प्रसाद सोनीस आहेत, डॉक्टर आसावरी पाटील आहेत, डॉक्टर मानसी पवार आहे, डॉक्टर गायत्री थत्ते आहेत, डॉक्टर अरुंधती सोनवणे आहेत आणि कुशल महाजन आहेत. त्या सगळ्या लोकांनी, काही लोकांची नावं राहिली असतील कारण मला सगळ्या लोकांची नावं एवढं इम्प्रेशन झालं नाहीये, पण या लोकांनी खूप जास्त एफर्ट घेतले. ही कॉन्फरन्स वेगळी का? कारण आपण नेहमी जीपी कॉन, पीडीकॉन किंवा इतर संघटनांची कॉन्फरन्स करत असतो. त्या ठिकाणी एक इझी असतो कारण की त्याला काहीतरी सिस्टीम असते, त्याला काही वर्ष गेलेली असतात. ते पहिलं वर्ष होतं. एखाद्या संस्थेने अशी कॉन्फरन्स करणं हे शक्य आहे. हे फार मोठं शिवधनुष्य आहे आणि ते खरंच आम्ही सगळ्यांनी मिळून केलं, त्याबद्दल आम्हाला सगळ्यांना आनंद आहे. थँक्यू व्हेरी मच.
Now I would like to invite Dr. Ramesh Bhange on the stage. Dr. Ramesh Bhange has done his MBBS and MS ophthalmology from BJ Medical College, Pune. He is the ophthalmic consultant surgeon at many renowned hospitals like Tarakan Hospital, Remedy Clinic, Pune Netra Seva Pratishtan, Pune Hospital, Hariwar Hospital, and many more. He was awarded Social Service Excellence by Pune Municipal Corporation in the year 2000. He has consistently conducted free cataract and squint surgeries for the past 14 years in rural areas. I request Dr. Ramesh Bhange to share his thoughts about the role of social work in a person's life.
Good afternoon, everybody. It's my pleasure to be here. I must thank the organizing committee, Bharti Vidyapith, and all the dignitaries and those who are attending the conference. It's a difficult thing for me to say how to implement your social work in your private practice. It is not necessary that all the time you should be paid for doing the social service. I am working with Pune Netra Seva Pratishtan for last 35 years. Initially, we were doing cataract camps. Over a period of time, we stopped cataract camps because everyone started doing cataract camps. What we wanted to do was we wanted to continue our teamwork as a donation or contribution to our society. We introduced squint correction camp. Nowhere in the world are conducting squint correction camps in the all over the world. We have done almost more than 200 squint surgical camps. We have operated more than 10,000 patients, including general anesthesia patients. And these papers were presented all over the world for our work, and it has been very much appreciated. Now, why I want to tell you all these things? Basically, the thing is that it's a type of community groups who are suffering. Looking at our population exposure and the amount of government services available and amount of expertise available, squint specialty is highly neglected all over the India. No one wants to operate squints. You won't believe every time that we see almost 400 600 patients we see in a camp. For last 35 years, we are going to Amravati, we are seeing 180 to 200 patients. We operate 120 patients in a day for screens. Why we operate? Because that is the class where we will never go to ophthalmologist or will never go to ophthalmologist and get the surgery done only for cosmetic. It is not the cosmetic barrier that matters. It is the social stigma that matters when you are living in the society. As we are continuing screen camps, I introduced doing ptosis surgery in the screen camp. Recently, last month, we have operated 140 patients of screen, out of which and with 20 patients was ptosis surgery in the camp, all done under general anesthesia. The thing is that it is our responsibility to take care of the society and our attitude towards society that matters. That is it is a social stigma. And what is necessary not that you should donate to the society by giving your services by money. The thing is that you can think of this as a learning society. You should have that vision. We are doing these things because so people bothered about screen. Females are bothered about screen. They are about the social stigma. Ptosis patient, they are about the social stigma. They don't want to get the thing done. Apart from that, there is a lack of awareness, not even in ophthalmologists, even in your practitioner, that people are unable, don't want to get operated for screens, ptosis, and other things. There are so many factors or so many other fields. It's just an idea that can eliminate the life in society, that can create an awareness based of anything. And my basic firstly, you should have the idea, take forward the idea. Someone might pick up that idea and can ignite and help the society to build a good society. And again, I'm thankful to the Bharati Vidyapith and I'm thankful to the Mukta Charitable Foundation and thankful to the organizing committee and everyone for giving me the opportunity to speak and talk of my social aspect about my devotion to the field for last 35 years. And thank you very much.
Thank you, sir, for your kind words. Now I request our organizing chairman, Dr. Praveen Tarak, sir, to please felicitate Dr. Ramesh Lines. Welcome all again to this academic speech of Medicon conference. Hope you all are enjoying it. COVID pandemic created a fear in our mind. But with our stalwarts like Dr. Dravid sir, who guided us how to manage such patients, we were able to update ourselves. But we are also eager to know about the epidemics since historical times. To tell the story about the epidemics in our history, we have Dr. Amit Dravid sir with us. We are highly honored to welcome you, sir. Consultant in HIV medicine and infectious diseases at Ruby Clinic, Global Hospital, Pune Hospital, Pune. For past 12 years, he has been involved in clinical and laboratory research related to HIV and PP diagnosis, prevention and treatment in the capacity of a physician investigator. His area of interest include HIV and CNS, antiretroviral therapy related to long-term comorbidities, HIV-associated PP and tropical infectious diseases. He believes in providing high-quality information to his patients on their conditions and management. He strives to provide best medical service in the field of infectious disease. So,
Thank you, Medicon. Thank you, madam. सकाळपासून मी बघतोय सोनार सरांचं पहिलं लेक्चर, युपीएस सरांचं दुसरं लेक्चर, आंबे सर येऊन गेले, लालवाणी सर येऊन गेले. सडनली मला असं वाटायला लागलं की रोहित शर्मा, विराट कोहली चलो स्पीकर बदल जसं बॅटिंग करायला येतो मी केलं कोण आला असं वाटायला लागेल होपफुली मग मी विचार करायला लागलो की कशासाठी आलो नाही इकडे नंतर मी विचार केला की मी जीपीएच्या एवढे स्पोर्ट्स टुर्नामेंट मध्ये भाग घेतलाय की जनरल प्रॅक्टिसला असं नको वाटलं की आपण खेळतच असतो पेशंट तरी बघतो का नाही त्यामुळे असं वाटू नये म्हणून मी लाथे खातर इकडे आलोय तुम्ही मला बघून बोर झाले असं कारण की 2 वर्षामध्ये आपण सारखेच भेटतोय जर 3 महिन्यात आज बरं तेच सांगायचं असं नको म्हणून आय जस्ट टेल यू अ स्टोरी माय होल lecture today is going to be a story. It's a mirror to what we are doing in 2023 have we really changed in the last 100 years. That's all I want to tell you in the next 15 minutes of my lecture. And I hope I can give you that. Next slide. So, जसं मी सांगितलं की epidemics or pandemics since last 100 years is not a new thing. मी सगळे कव्हर करत बसलो तर इथले सगळे लोक झोपून जाते. So I just stick to the viral pandemics and back to the viral respiratory pandemics. त्याच्यामध्ये जनरल प्रॅक्टिसचा खूप मोठा रोल असतो. They are the first ones to see the patient and they are the first ones who can understand whether the patient is serious enough and whether he needs referral. So in the last 100 years, what are the viral respiratory pandemics which general practice has seen and has the scenario changed in the last 100 years? In slides बघा तुम्हाला लक्षात येईल की हे खूप सिमिलर गोष्टी 2023 मध्ये होत आहेत ज्या 1918 मध्ये पण होत आहेत and then you will realize की आपण काही चेंज नाही झालं as human beings we have learned. मॅडम मी आता हिंदीत बोलायला सांगितलंय मॅडम हिंदी माझी तिसरी लँग्वेज होती मला 50% पॅकिंग लागेल त्याला एकच पाहिजे मराठी बोलतो we'll go to influenza virus. That is the first virus which I am going to talk about. ही 1918 ची घटना आहे आपण 105 वर्ष मागे जातो. It is supposed to be the most devastating pandemic in modern history. त्याच्यामध्ये साधारण 5 कोटी लोक झाले आणि त्याच्यातले साधारण 1% लोक एक्सपायर झाले. त्याचं नाव स्पॅनिश फ्लू पडलं ते का पडलं ते नंतर सांगतो. त्याचा एक डब्ल्यू नावाचा ट्रेंड होता की लहान मुलांमध्ये तो खूप जास्त होता एल्डरली लोकांमध्ये जास्त होता आणि थोडा एक छोटा स्पाइक यंग ऍडल्ट्स मध्ये होता पण एक्स्ट्रीम्स ऑफ पॉप्युलेशन मध्ये हे इलनेस दिसला आणि लंडन मध्ये एक केबल आली आणि लक्षात ठेवा 1918 मध्ये वर्ल्ड वॉर 1 चालू होतं. स्पेन वॉज अ न्यूट्रल कंट्री. स्पेन मध्ये सगळे मीडिया फ्री होतं. इंग्लंडमध्ये जर्मनीमध्ये मीडिया ब्लॅकआउट होता. काही वाईट खबरा सांगायच्या नाही असताना क्लिअर इन्स्ट्रक्शन होते. त्यामुळे इंग्लंडमध्ये सांगितलं स्ट्रेट फॉर्म ऑफ डिसीज ऍक्चुअल इन मॅड्रिड वेर एव्हरीबडी इज फॉलोइंग सिक. इट इज ऑफ माइल्ड नेचर. एव्हरीबडी इज अफेक्टेड बट देर आर नो डेथ्स. सो दिस वॉज द स्टार्ट. मग युएस आणि युरोपियन म्हटले जाऊ दे मॅड्रिडमध्ये आपल्याकडे नाही आपण काय बोलायचं आपण शांत राहायचं आपलं वॉर चालू आहे ना ते सांगतो वर्ल्ड वॉर वर. नियरली 90 years लेटर आपल्याला 90 वर्ष लागले तेव्हापासून आतापर्यंत ऑलमोस्ट 30 वर्ष लागले हे डिसाईड करायला की अरे तो जो होता पॅन्डेमिक तर व्हायरस मध्ये झाला होता आणि तो इन्फ्लुएन्झा व्हायरस मध्ये होता. तेव्हा आपलं सायन्स एवढं प्रगत नव्हतं. आपण असं 10 दिवसात त्या व्हायरसचा जिनोम बाहेर टाकू शकत नव्हतो. कुठलं व्हायरस आहे ते आयडेंटिफाय करू शकत नव्हतो. त्यामुळे त्या लोकांना 1940 उजाडलं सांगायला की अरे 1918 मध्ये जो झाला तो इन्फ्लुएन्झा पॅन्डेमिक होता. आणि काय होतं की बरेच लोक म्हणतात की तो स्पेन मध्ये झाला. मुझे हिंदी में बात करेंगे. So the Spanish people were actually giving skilled and unskilled labor to England, to Germany, to fight because those skilled people in Germany were involved in war. So what was happening was they were sending skilled labor over there. In one of the English or the German army camps, they got infected. They came back, they spread the flu in Spain, and it started known as Spanish flu. So जैसे हम बोलते हैं कि वुहान वायरस actually originated from Wuhan,
but Spanish flu originate नहीं हुआ स्पेन में, स्पेन का ऐसे ही नाम बदनाम हो गया। So 1918 was known as the Spanish flu, but actually it should have been known as the English flu or the French flu or the German flu. The Spain, because it was a neutral country, it was a free country, unnecessarily just got all the bad name. So you can see unskilled labor, skilled labor going from Spain, Portugal to Germany, getting infected, coming back and giving the same pandemic to their people. So what happened? Spain में क्या हुआ? Because there was war, inflation was high, but during inflation was high, the king was under pressure. कि कुछ करो, बहुत गरीबी बढ़ रही है, तो इस ऐसा करो, फेस्टिवल मनाते हैं, जैसे अपने को हम करते हैं. If you want to deflect anything, we start doing festivals, we start doing publicity over right. So they did festivals. And what will happen in festivals? If all people come together and everybody has viral upper respiratory tract infection, we will get a pandemic. So that is what happened. So humans will not learn. When there is a pandemic, we will have political activities. When there is a pandemic, we will hold weddings, we will hold all other mass gathering events. And they will say, oh, yeah, COVID बहुत फैल गया है. This is the same thing they did 100 years back. So we have not learned anything from this. So people were saying, sir, postal services are getting affected. Telegraph services are getting affected. Doctors are falling sick. No, we will celebrate. Viral respiratory tract infection might have. What is the problem? These basic health officers, they are unnecessarily creating panic. They are saying people are going to die. Nobody is dying. Everybody is having mild epidemic. Remember first wave? We overcome. We did this, we did that. Same thing Spain did in the first wave. And after 2 months, everything was normal. हो गया viral respiratory tract infection, हो गए 20-50 million infected, कोई मरा नहीं, hardly कोई 10-12 लोग मरे. अब mild epidemic था, तो क्या हुआ? अपने को तो पता नहीं चला कि वो क्या है. आया गया. 2 months बाद everything is normal. That's what happened in the COVID first wave. Everything back to normal. Then what happened? As usual, when you don't learn, disease comes back. This time the disease came back with a vengeance. The second wave was very hard. This time people started falling sick. People started getting pneumonia. People started getting ARDS. People started going on a ventilator. Hospitals started getting full. And then people woke up. Arey, this is something very dangerous. People said, "Arey, ye kya ho gaya?" All road, railway, basic services, all affected. Everybody either sick, either in quarantine or admitted. अभी क्या करने का? So then suddenly अपने आप में जो जैसा होता है कि when you don't know what is the cause, you start disinfecting it. जैसा हमने suddenly सारे रास्ते धोना चालू कर दिया. उन्होंने कैसे किया? Theater, cafeteria, church, traveler, baggage. ये हमने कोविड में भी किया. Respiratory virus, cleaning the hall, cleaning the house, cleaning the road, don't spit. Arey baba, how is that going to prevent COVID? It is not going to prevent. But they started disinfecting everything. Spitting was banned. Schools were banned, but churches were allowed. Why? Religious activity and religion and science don't go together. Suddenly I became anti-national if I start saying better not to say. So what happened was the same thing. People were saying, sir, there is a viral upper respiratory pandemic going into pneumonia, going into lower respiratory tract infection, patients developing pneumonia. You shut down the country, declare an emergency, put everybody in lockdown. What happens? The church priest comes and saying that this is the wrath of the God, the evil of the God. जो भी होगा भगवान की मार्ग से होगा. जो होना है होने दो, हम हमारा मास्क करेंगे. ठीक है भाई. So the mass started 10 times bigger. So what was going on? This is what the same thing happened in India during the second COVID wave. They all seen it. The characters might change, the heroine might change, script remains the same 100 years later. Okay, so people have started realizing that initially it's a viral pandemic. Now there are bacterial pneumonia which is happening. People are going on a ventilator. People are very sick. What to do? Nothing was done. So what happens? You can see hospital admissions 10 times higher in October, November, December. 2 months lull, 10 times higher admissions. They have all seen it. No oxygen, no hospital, no bed. People running around for essential supplies. They have all seen it. So people are telling them basic things. avoid direct contact with cold people, remain outdoors, let the air pass through, खिड़कियां खुली रखो, because that time there were no vaccines, there were no treatment. If you are sick, stay at home. Basic things were told. This is what is going to happen. But the disease was so much that the health system was completely overwhelmed. So what happens? You can see here, people are roaming around with sir, सबको disinfect करो. हमने नहीं किया था वो कुछ तो sterilization लेके, सबको sterilization करो. That time it was known as Cetol, Japan Cetol. वो sterilization था उस time. So उसके ad आने लगे. But what happened is what happened in the second wave. Funeral homes, churches, the deceased. People ran out of coffins. The mayor of Barcelona requested the army to bury the dead. Some special laws were approved that there will be no 2-3 day funeral ceremonies. There will be 1 hour funeral ceremonies. वहां पे ऐसा होता है कि अगर कोई मर जाता है तो वो चर्च की घंटा बजाते हैं. इतने मर गए थे कि शायद दिन भर वो चर्च की घंटा बजाने पड़ती. So they banned that practice also. ये कहीं सुना है क्या हमने? सुना है. ये इंडिया में भी हुआ है. सिर्फ अलग जगह पे हुआ है. We have seen bodies in the Ganga. We have seen people cremating lines of people during the second wave. So you can see we don't learn. 4 or 5 page obituaries started appearing in newspapers. Have we seen that? Yes, we have seen that too. So many people died. In fact, 260,000 Spaniards died in 3 months. And it was so bad that their population growth became negative. Just imagine, हम 140 CR से suddenly 120 CR हो गए. No young people who work. That is what happened. It was so devastating. This has happened 100 years back, but we have not. Then it spread to other countries, as it always has. हो गया. Spread everywhere. Then it became so bad. Happening in the third wave, has happened in the third year also. एकदम mild. आया गया कब गया पता भी नहीं चला. Herd immunity आ गई थी. Everybody was fine. It just became a minor disease. Everything was fine. You can see people who died 1 lakh in the first wave, 21,000 and 17,000 after that. So the mortality came down. Same, whatever happened in COVID, 105 years later, it happened in Spanish flu 18 years later, 105 years. So if you introduce a new virus in a vulnerable population, which has zero immunity, who doesn't learn? This is what happens. This is what history teaches us, and this is all documented. These are all newspaper clippings and research paper which I am quoting. It is not out of my own mind. This is actually published. And the first thing was the silence of the press. In Spain, everybody was talking because it was a neutral country. In England and Germany, nobody was talking because they were at war. War is not important. This is not important. This disease has killed 260,000 Spaniards. How many died in World War I? Less than that. But we will not talk. Newspapers will not write. To write something wrong or something away from the official, you will be put in jail. That's what happened in China. They kept quiet for 3 months. Hey, nahi COVID hamare yahan. Aaya hi nahi hamare yahan. Only 4,000 people have died. Maro fir, sabko maro. This is what happened. Same thing has happened. Nothing has changed. 105 years later, they are seeing the same. Only, जैसे मैंने बताया, hero heroine change हो गया, script same है. And development of herd immunity. So people say, third wave को क्या हो गया? Everybody had herd immunity. Initially, the first wave, the maximum people died were physicians, nurses. In the third wave, who did not fall sick, were physicians, nurses. Obviously, because they were seeing patients, they had developed herd immunity. There was no vaccine, there was no treatment that time. They developed herd immunity. So other people might be falling sick, but physicians were still working. So then they understood that there is a concept of herd immunity. So all these things have happened 105 years back. Then we jump 50 years ahead. So first lesson, in 105 years, we have learned nothing. We have done the same mistakes which we did 105 years back. Now we come to the second mistake. Maybe what happened in 1968? It was a seismic year for world politics. What happened? Assassination of prominent leaders. I think Martin Luther King, John F. Kennedy died that time. Then public demonstrations against those deaths because people are getting killed. Then there was significant scientific achievement like heart transplant, unmanned space flights happened in 1968. But nobody remembers that there was a pandemic which happened in 1968. which was not H1N1. That was the 1918 pandemic. What happened was H3N2, which was another influenza virus, which actually caused the pandemic, but we have not known about it. And I'll tell you how it happens, and we don't learn and how it comes back to haunt us. So what happened? It was H3N2. At least they found out that it is H3N2 earlier. They did not take 20 years to identify influenza virus. Patients developed typical influenza-like illnesses. It started in Hong Kong, Vietnam, and you remember there was a Vietnam War going on that time in 1968. So what happened was the American soldiers came back from Vietnam into America and gave that H3N2 to America. From Hong Kong, Vietnam, it spread to India, Thailand. It became so bad that the Apollo 8 astronauts who were to be sent into the moon for the first time had to be vaccinated by Inco H3N2. It was so bad. So you can understand that if you don't learn anything, this is how the virus spreads. Vietnam war है ही नहीं, Vietnam में कुछ हुआ ही नहीं, अमेरिका जीत रहा है, ठीक है, इन लोग ट्रूप्स वापस अमेरिका में हो गया H3N2 अमेरिका. And why was it important? Because potent and more potent at killing you. Complications were higher. Therefore, people were developing pneumonia, people were developing myocarditis, people were encephalitis. 3 times increase in staphylococcal infections, till then staphylococcus, pseudomonas had been isolated, तो पता ही नहीं था. They were increasing, complications were increasing, so people realized that ये influenza पहले वाले influenza से और dangerous है. और वो क्यों फैला है? वॉर के कारण. अमेरिका गया वियतनाम, घुस गया उधर हो गया इन्फेक्शन, फैला दिया सब. But war is more important than disease. Remember that always. So then everybody forgot because after 1968 nahi aaya. But remember that over last 50 years, H3N2 has killed more people than even pandemic and. So remember, we don't learn our lessons. We just don't learn our lessons. We don't treat the viruses seriously. This is what happens. 10.8% was the mortality rate when at the peak of H3N2. Then came our favorite, again 50 years jump, 2009, H1N1. We are just dealing with influenza virus. हमको लगा अपने को H1N1 क्या मतलब influenza virus से deal करना है. इसके आगे कोई दूसरा आएगा ही नहीं. So pandemic H1N1 आ गया. What did pandemic H1N1? It just took genes from birds, pigs, humans, got a new virus, and then acquired the ability to infect your lower respiratory tract. Infect you, cause pneumonia, cause complications, get admitted. So this virus is smarter and smarter and smarter. And we are getting more and more and more foolish. You can understand what is going to happen. And you can see since 2009, every year there is one spike of H1. This time in India, we had a spike of H3N2 also. And then suddenly realized, अरे 50 साल पहले आया था ना 1968 में, अभी आ गया वापस H3N2. अरे भाई वो यही था. It is just getting more potent. You are just close your eyes. That doesn't mean the virus is not there. It is there. You can see every year. Influenza viruses are causing. At least now we have guidelines. At least now we know how to treat. अगर influenza है तो oseltamivir दे दो. अगर influenza है तो सबका RT-PCR करो. Regardless whether it comes positive or negative. If you have upper respiratory tract symptoms, do random tests. Anything can land up on a ventilator and die. Remember that. Remember that there are certain people who are specially affected. That means those who are immunocompromised, who are diabetic, who are hypertensive, are at risk. Peripartum people, women, pregnant women are at risk of influenza. Treat them. And this is what happens. If you don't treat H1N1, if you don't read about H1N1, it is not going to leave you. This is what is going to happen. ARDS, it can cause it. And if you treat the patient on a ventilator, what do? We give antivirus, we give oseltamivir, everybody. We now even give chemoprophylaxis with oseltamivir. The patients were to the other person who is infected, so that she doesn't get infected. So the science is it, but we still keep making mistakes. How to treat bacterial infection? We know that every influenza will have either staphylococcal infection or pseudomonas infection. Antibiotics should be given, either levofloxacin or moxifloxacin along with oseltamivir, so that you prevent bacterial co-infection. That we know. Do we give steroids in influenza? We don't give steroids because there is no clear-cut evidence that it helps. But in some patients at Noble, we have found that steroids do help preventing ARDS, so it should be used. Then why is CDC concerned about H3? ये तो सब आपने बताया. Why? Because H3N2 has a lower respiratory tract prevalence. It can cause pneumonia. It can cause immune evasion. And the vaccine which we are using right now doesn't protect as much against H3N2 as it protects against H1N2. And that's why CDC is saying that if H3N2 pandemic वापस आ गया, it will be even more. Remember, we have a problem on our hands. So do we need influenza vaccination? Yes, entire year is influenza vaccination. Flu shots. Should it be taken every year? Yes, it should be taken every year. Which are the ones it should be taken? April and May. How many people take it? सीखा? 2 साल हो गए, कुछ नहीं सीखा. So we don't take influenza vaccination. अपने यहाँ पे adult vaccination का नहीं था, कोविड ने सिखाया. अरे बाप रे, adults को भी वैक्सीन की जरूरत है. अरे भाई, adults को इन्फेक्शन की भी जरूरत है. So you have to take one influenza vaccine annually. It will protect against pandemic H1N1. It will protect against H3N2. But you should have your eyes open. The same mistakes will happen again. Now we come to coronaviruses. History of coronaviruses. I am not going to go into COVID in detail. What happened? हम वैसे ही 2002 China. First time they thought that there is a condition which is causing acute respiratory tract illness and pneumonia and breathlessness. They identified that this is not influenza virus. This is coronavirus. What it was called? Severe acute respiratory tract syndrome, SARS coronavirus 1. How many people did it kill? 8,096 people. How was the sorry 8,000 infections, 774 dead. That time it did not have pandemic potential. It had killing potential. It would kill people. It would not spread so much. बच गए. चाइना में बना और वो चाइना के आजू बाजू में जो कंट्रीज है हांगकांग विंडो उधर हम बच गए. इंडिया में आया नहीं. 2002 के बाद क्या हुआ? 20 there was another coronavirus which came. What was it? Was named Middle East Respiratory Syndrome. ये कैसे? It came from camels, dromedary camels. You know, in Saudi Arabia, people they use camels everywhere. Camels में हुआ coronavirus. वहाँ से हुआ इनको. Again, acute respiratory tract infection. Again, it had killing potential. It did not have pandemic potential. It could not go fast. So, how many people had? Only 700 confirmed cases, but how many dead? 600 dead. 30% mortality. Hope nahi hua. That was the thing. So, 30% mortality in 2012. Warning signs were there. Don't tell us that coronavirus COVID-19 didn't warn us. It warned us, but we are in our own world. So you can see out of SARS and MERS, most 45% cases were linked to hospitals. They were not in the community. One MERS patient admitted in the hospital, infecting 170 in the hospital. One SARS admitted in the hospital, infecting 50 people in the hospital, but not infecting in the community. So it did not have community transmission. It was waiting to acquire community transmission. So, like you can see, majority of the infections occurred in healthcare workers or people admitted in hospitals. You can see what were the symptoms, one of the same. Chest X-rays were abnormal in 100% of people. It was worse than COVID. If it had pandemic potential, it had walked, it would have wiped 30% of the world's population. Thankfully, God did not give it pandemic. It just gave it killing potential. देवपंडा जरा विचार करूनच आपली बात. That's it. So it gave it COVID, it gave killing potential, it did not give pandemic potential. But that time also people are saying all this was occurring in people who are diabetic, hypertensive, cancer, renal. It was occurring at that time. And you can see 36% mortality and 10% mortality for SARS. How much is it for COVID-19? 2%. So I am lucky that this did not come to India. So I don't know what क्या होता था और मैं कहाँ Zoom पर क्या क्या बताता था. This is what happens. You can see it started from the bats. We knew in 2002 it is starting from the bats. From there it is going to the animals like palm civet eaten in China. From there it is going to human beings. They are getting admitted in hospital. From hospital it is going to other places. Why? Because जब तक आदमी symptomatic नहीं हो जाता, they could not transmit SARS. They could not transmit MERS. But in COVID-19, you are not people who transmit it. वो potential उसमें आया नहीं था. That's why pandemic नहीं हुआ, बच गए. 36% mortality लेके. Camels में भी जो हुआ, it could have, if you get symptomatic, only then you shed the virus. If you are asymptomatic, you don't shed the virus. This was SARS and MERS. Life cycle same thing, just like COVID-19. ACE2 receptor under Russo and then start infecting the other cells. And that time also there were protease inhibitors. There was our friend convalescent plasma. There were our friend monoclonal antibodies. All of this we have thought about in COVID-19 pandemic. Were there 20 years back. They thought about it still because the epidemic ended early. The research stopped. We forgot. आंखें बंद कर ली. कुछ नहीं होगा. बस सब चलता रहेगा. हम लोग वो क्या wild animals खाते रहेंगे. और कोविड कुछ नहीं होगा क्या होगा so if we don't learn from our mistakes what happened for SARS-CoV-2 it came in a more refined version killing power कम हो गया pandemic potential that is what happened everywhere it was chaos and in the second wave same thing happened which happened during 1918 second wave so in 105 years we learned nothing but so initial variant second Indian variant आया, Delta variant आया, and we all see, we all know what happened to Delta variant. I don't need to tell you. Then Omicron आया, so अब variant आए जा रहे, but third wave might not causing much problem, just like influenza. पहले South Africa में आया, फिर सारे countries में फैल गया, and now Omicron has immune evasive ability, but cannot cause disease. So we have reached third wave of influenza to third wave of COVID-19. It doesn't kill you and vaccination helps you and thankfully we have drugs and we have vaccine. So you can see the third wave of COVID-19 there were lots of cases but no hospital admission and very few on ventilator. While the second lots of cases, lots of hospital admission, lots of ventilator, lots of deaths. Same there is no change in pattern. This is what happens. So but we now have therapeutic agents. We know that in the first 7 days, antivirals work. In the next 7 days, anti-inflammatory drugs work. We know that Paxlovid is #1 drug. Actually, even within first 5 days, it will prevent progression. If it is molnupiravir, it will help in the first 5 days. Remdesivir will help in those 5 days if given. So antivirals do work. Once the patient develops ARDS, steroids work, Osozumab works, Arcetinib works. This thing was thought about 20 years back because we had so many patients, we could do clinical trials to prove that this does work. But this drug would have worked other things. So, Casivimab now doesn't work, monoclonal antibodies don't work. But because Omicron is so different from the second wave, we need vaccination and we need vaccination. So we need vaccinated and we need to be boosted because if you are vaccinated and boosted, then your chance of getting COVID or dying because of COVID or complications because of COVID or long COVID. How many are triple vaccinated here? 100% भी नहीं है. Doctors भी नहीं है. 12% is our triple vaccination rate. I rest my case. I don't need to say anything earlier more. So अगर वापस करें कुछ हुआ तो याद रखना क्या किसके कारण हुआ है. Just told you what is going to happen. So the total doses in low-income countries are actually lower than the booster doses in high-income countries. You can see कितना vaccine change है. And now if you take triple vaccination, then Omicron is actually less invasive than influenza, which has a mortality of 0.004%. It is lesser than influenza. हम नहीं सुधरेंगे, तीन वैक्सीन तो लेंगे नहीं, घर पे बैठ के तीसरे चौथे वेरिएंट की राह देखेंगे, भुगतेंगे. This is what you know. You can see. और मास्क भी नहीं पहनेंगे. Then you know, use of N95 mask, your chance of getting COVID is lower than 83%. Vaccines, masks, physical distancing, that's it. You can help. Swiss cheese model, ये सब follow करो, होगा ही नहीं COVID, मरोगे ही नहीं COVID से. But do we learn? That is a big question. And look at the Lancet paper, 5 times higher mortality in India because of COVID-19. We have actually underreported our mortality by 5 times. So if we have 5 lakh mortality, actually there were 25 lakh people died for COVID-19. In a 140 crore population, do your maths. How many people died? And this is in Lancet. I am not putting it. You can last tell ye kya kiya, you are anti-national. India 5 times. And we still have not learned, because of which we get people who long COVID. People who have got COVID 2 years back still complaining, sir, I have not come back to normal. My activity is only 60%. कुछ भी करने जाता हूँ तो छाती में धड़धड़ होता है. बात करने जाता हूँ तो मैं भूल जाता हूँ कि मेरा ट्रेन ऑफ थॉट क्या है. Loss of memory, weakness, body ache, all these things are happening. Long COVID. And why? Because we did not prevent COVID. We just let on. ये लोग 2 साल के बाद भी पेशेंट आ रहे हैं. Long COVID, diagnosis is long COVID. But now there is a drug that is metformin, which is known. ये अपना anti-diabetic drug metformin. You can actually reduce long COVID as well. This study was just published yesterday. So you can see your patients of long COVID, one metformin can help in reducing the hypertension. So last slide, in conclusion. Influenza viruses in the last 100 years have caused viral pandemics and human mortality due to their ability to cause antigenic shift and drift. So H1N1 कभी आता है, H3N2 आ जाता है, कभी H7N9 आ जाता है, कभी H5N1 आ जाता है. वो आते ही रहेंगे और इसके आगे भी आते रहेंगे. H1 and H3N2 currently continue to haunt us, but I will not be surprised if H5N1, H7N9, H1N9, some fish flu will come and start hitting us. Coronaviruses are the new variant that displaced influenza viruses as public health emergencies. COVID-2, so COVID-1 and MERS COVID actually had humongous killing potential, but they did not have pandemic potential. But now we are saddled with SARS-CoV-2, which is a perfect storm. It is 2%, but spreads to crores others. And it has now become endemic from pandemic. So don't be surprised if every year, just like we get H1N1 spurts in India, H3N2 spurts in India, we prepare for COVID-19 spurts in India, especially during the rainy season and the winter season. And as general practitioners, be ready. We will all fight this together. Thank you.
Sir, for a very interesting talk, and I request Dr. Padman to participate of our I'm sure by now you must be feeling hungry, so we have a lunch break now. But please mix to the center of the group, and you will all answer the questions and after the lunch. I hope you all enjoyed the lunch. Please do. After that, we will start the next session. So we will have a 30-minute break for lunch and stop. And then, please be on time. And same volunteers, please wait for a few minutes.
Ayo kan